the concept of climate change might feel abstract.
When I think of climate change, I always just think of what do I see locally, and how can we do something now about it? We'll see these heavy rain pours on our communities, and then the rest of the summer it's dry. So not only is it impacting agriculture, which Kansas in general plays a pivotal role in that, but it is also impacting communities that live in neighborhoods that do not have adequate drainage systems in place to help protect them for when these floods occur. And they're also right next to the river. So there's this constant overflowing and flooding in communities that have housing that are deteriorated, poor weatherization.
Having been in Texas for about 12 years by then, the long days of what they call the hot summer in Texas, I've experienced that, and I know how it impacted the lives of many of our community members. As a health executive, I see too often, especially in the hot summers, the impact of climate health to respiratory illnesses. We can just tell and almost predict how many patients we'll have in the ER just based on what the temperature would be.
As we're having higher heat days, we're also having higher heat strokes. We're having more visits to ER because of asthma exacerbations. And we need to consider all of that because that is going to affect not only our households, our jobs, but also our economy.
Climate change is a huge topic, and one single person cannot, flip the switch and get rid of climate change.
Healthcare professionals must commit to curbing the environmental onslaught and the detrimental effects on health.
Climate change impacts every aspect of health, and if we don't address mitigation and adaptation, there are going to be dire consequences, especially for some of the most vulnerable populations and the populations who are least contributing to climate change.
So I think just how these systems have been in place over time, there is an opportunity through legislative action as well as advocacy to put policies in place to ensure disproportionate communities of people don't have those higher exposures. So I always say equity has to be at the core of what we do. And that begins with dismantling structural racism, which impacts environmental and climate health, that unfortunately already impacts vulnerable populations of people that are already disproportionately impacted.